Hi, this is Dr. Christy DeSapri, founding physician at Bone and Body Women's Health. This morning I had the great honor of giving ground rounds at the Hospital for Special Surgery in New York City. So this was a great group of physicians, clinicians who are focused on osteoporosis from preventing and treating fractures in the orthopedic community. So they had me talk about hormone therapy, which is something that they are not familiar with. The questions were really great in terms of the fact that they know that hormone therapy prevents osteoporosis, but what do we know about treatment? I think the most important thing to understand in this area is that we do not have a osteoporosis prevention treatment study in women who are on hormone therapy. The best research we have are some observational studies and the Women's Health Initiative study of more than 27,000 postmenopausal women on average in their 60s, anywhere from their 50s to their 80s, that showed that fractures were prevented on the order of 30 to 40%, both in the hip and the spine, and the bone mineral density improved. And this is actually very similar to some of the other osteoporosis treatments that we used. So this was very shocking to them. They learned a lot. I always feel like it's so important to share the information outside of the world of women's health with other clinicians, with other specialties, because they all come in contact with these women, with midlife women. And particularly they were talking about things like surgery. So they often recommend that they remove or women stop hormone therapy before surgery. But remember, hormone therapy, particularly for using things like transdermal or on the skin estrogen, does not increase the inflammatory markers, does not go through the liver, does not increase the coagulation markers that increase the risk for a blood clot. So after the study, we really talked about thinking about their processes and their protocols for recommending hormone therapy for women with bone health issues, osteopenia, prevention of osteoporosis, and treatment of women who are at low absolute risk for fracture who have osteoporosis. So it always gives me great respect and just really great understanding when I hear and speak to other groups about how we can treat midlife women better and more comprehensively. I hope to see you soon.